isometric measurement of shoulder flexion. First we have to identify the limit of range, starting from 0, stabilizing the thorax, flex the shoulder, stabilizing the rib cage until we meet firm resistance. Then the goniometer is aligned. So that the stationary arm is aligned with the mid-axillary line, and the moving arm is aligned with the shaft of the humerus projected down to the lateral epicondyle. Shoulder abduction. Stabilizing the thorax. Taking the humerus to end range. Then aligning the goniometer. Parallel to the sternum and align with the shaft of the humerus. Slide a little bit to your right, a little bit. Internal and external rotation is done if the patient has at least 90 degrees of abduction at the 90-degree angle of abduction. External rotation, the scapula is stabilized by the table. The goniometer can be aligned with either the horizontal or the vertical. The stationary arm, moving arm, is aligned with the olecranon. From the olecranon to the ulnar styloid at the forearm. And with internal rotation, here, if we're going to do purely glenohumeral internal rotation, you need to stabilize the scapula. So we can take this humerus, medially rotated, scapula stabilized. Same alignment as lateral rotation. Okay. With many patients that we're measuring their range of motion, they're unable to achieve 90 degrees of abduction, in which case you can take these measurements from a modified position, that being 45 degrees of abduction for external and internal rotation. Okay, next we're going to do is shoulder extension. If we do glenohumeral shoulder extension, we're going to be stabilizing the scapula. We're going to be aligning the goniometer with the horizontal, that's the stationary arm, and the humerus setting down the lateral epicondyle with the stationary arm. Now we're going to go into some of the muscle length tests. First being the upper fibers of pec major. For upper fibers of pec major, I'm going to abduct the shoulder to 90 degrees. Then we're going to stabilize the torso and then horizontally abduct the shoulder, stabilizing the torso so that you're allowing the scapula and the humerus to move. And you should get approximately 45 degrees of horizontal abduction. Be careful not to allow the humerus to medially rotate or adduct, because you'll lose the length assessment of that muscle. This is for the lower fibers of pec major. So we're going to take the shoulder at an abducted angle of about 135 degrees and attempt to lower it to the table, seeing if the distal aspect of the humerus can reach the table, thus assessing the length of the lower fibers of pec major. Note the knees are flexed to help maintain the stability of the lumbar spine so that it doesn't hyperextend with this test procedure. Length of distance dorsi, flexing the shoulders This also tests the length of teres major. According to Kendall, the elbow should reach the table with the knees and hips flexed. Lats and teres major, there's a few signs that would indicate one muscle being tight as opposed to the other. In the case of teres major, when it's tight, it will tend to pull the inferior angle of the scapula greater than 1/2 inch beyond the thorax. Also, according to Kendall, if external rotation is full, yet the teres lat length test is limited, that would indicate that it's the lats that's tight rather than the teres. For pectoralis minor, palms up, hips and knees flexed. We're looking here to see the distance of the scapula from the table. In the case of a tight pec minor, which he has on the left, it causes a forward tilt or anterior tipping of the scapula. You can also test the resistance of that muscle in terms of the ease with which you can bring the scapula back to the table.